I will start. Sorry, Dr. Azza. Assalamu alaikum. How are everyone? I will read the scenario, Dr. Azza. Sorry for the distracting. Mr. John, 30 years, male, present with fever. Pulse is 86. Blood pressure 130, 80. Over 80. Fever 38.5. And respiratory rate 20 20 breath per minute. Yeah, okay, Dr. Dr. Sam will start the timer. Dr. Azhar will be the leader with you in this week. Sorry for interrupting. And anything, you can contact me privately if you need any help. Good luck,
Do
Dr.
today
Azhar.
only, okay?
No. If you, yeah, you are today, Dr. Sam, for today.
Okay.
And I will try to
Because
solve the
after
problem.
this,
Stanley.
I'm very
No,
busy.
no problem. It's okay. No, my dear. We will solve it, okay?
No problem. Thank you so
So
much.
you can start now, Dr. Azhar and Dr.
Okay,
Rita.
start it. Okay, start.
Good evening. I'm Dr. Muhammad, one of the doctors in the clinic today. May I confirm that? Are you Mr. John, 30 years old?
Yes.
Mr. John, we are here to have a discussion about some issues related to your health, and I will examine you and then address your concern. Is that okay with you?
Yes.
Mr. John, I received your JB letter and I become to know that you are unwell these days. May I know what brought you to the clinic today?
Doctor, I'm having fever from the last 3 weeks.
Okay. Is it all the time or at a specific time at the day?
No specific time. Every time I'm having this fever.
Is it high grade or low grade fever?
It's not high grade. You can say when I measured, it is around about sometimes 39, sometimes 38.5 like this.
Okay. Did you use anything to help this fever, or did you contact seek any health advice?
Only I took paracetamol and it only gave me temporary relief.
Okay. Is this fever associated with any night sweat?
Yes, I have night sweats.
Do you have any lumps or bumps in your body?
No.
Okay. Do you have been abroad recently?
No.
Is this fever associated with any weight loss?
No.
Any loss of appetite?
Yes, because of this fever, I'm thinking that my appetite is not good.
Do you have any headache?
A little bit, not so much.
Okay. Do you have any cough with this fever?
No.
Any shortness of breath?
No.
Okay. Do you have any loose motions?
No.
Any throwing up or feeling sick?
No.
Do you have any yellowish discoloration of your eyes?
No.
Any back pain?
No.
Okay. May I ask you if you have any long-term condition I should be aware of?
No, but only I have the high blood pressure
For how long?
from 10 years.
For 10 years. And what do you take for this high blood pressure?
I'm taking Ramipril tablet.
Okay. Is there any underlying cause for this high blood pressure?
No, I do not know.
Okay. Apart from this high blood pressure, do you have any other long-term condition I should be aware of?
No, I don't have any other condition.
Okay. Is this the first time to have this fever, or you have fever previously?
No, this is the first time I'm having such fever.
Okay. Do you have any contact with sick persons recently?
No. No.
Okay. Uh, Do you have any joint pain?
No,
Any skin rash?
no.
And
Only
any rash? Mm,
okay, okay.
what?
No, no, no. You continue, continue.
Any rash on sun exposure area?
No,
Okay. Do you have any chest pain?
no.
Any awareness of your heartbeat?
Yes, I am having my. Sometimes I'm feeling that my heart is it is racing.
Okay. Do you have any ankle swelling?
No,
Okay. Do you have any shortness of breath?
no,
Any shortness of breath when lying down?
no.
Do you have any eye redness?
Yes,
For how long?
same with the fever.
Same with the fever. Do you have any soreness in the private area?
No,
Sorry for this question. Any soreness in your mouth?
no,
Any change in your water work?
yes, yes. I have noticed that there is some frothiness, like what you want to. Okay, some
Uh,
frothiness.
okay, for how long you have this frothiness?
Maybe around about 4 5 weeks before.
Okay, any change in the color of your water work?
Yes, it is red in color. I am feeling that sometimes I'm passing red urine.
And
Sometimes it
for
is
how?
clear.
Okay, I'm sorry for that. For how long you have this red urine?
From 2 weeks.
For 2 weeks. Do you have any sore throat?
Uh, no, I don't have.
Uh, any uh, any ear pain?
No,
Okay. Do you have any joint swelling?
no.
Okay. Um, but can I ask you, is there any similar condition in the family?
No,
Any disease running in family?
like my mother, she is having rheumatoid arthritis. My father is having a problem in his wall, like somewhat they told me that he's having his wall is not working normally. But
Is what? I'm sorry, I couldn't
uh,
get you.
my father, my father is having well problem in his heart.
A valve problem in his heart. Okay.
I do not know.
Yeah. Um, uh, you tell me you have no skin rash.
Yes, yes, no skin rash.
Okay. Mr. Do you have any valve problem as well,
I do
or
not
any
know.
heart problem before?
I don't have any problem with my heart before.
Okay. Previously, do you have any recurrent sore throats?
No,
Okay. May I ask you, what do you do for living?
I'm tattoo making.
You are?
People are coming me and they are saying, please make tattoo on my body.
Okay. Do you recently have any tattooing?
Yes, 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 yes. This is my job. I'm professionally making tattoos on different peoples.
For yourself, do you have any recent piercing or doing any new tattoo?
No, recently I don't have, but sometimes I have prick with my own instruments.
Okay. Okay. Do you have I'm sorry for this question. Any use of recreational drugs by any chance?
Yes, I am using cocaine.
Okay. Any sharing history of sharing needles or like this?
No.
Okay. Do you have a partner?
Yes.
Do you practice safe sex?
Yes. Yes.
Okay. Do you smoke, Mr. John?
Yes. 10 cigarettes per day for 10 years.
For 10 years. Actually, the smoking is not good for health. And if you want, I can send you to smoke cessation clinics. They can help you to quit smoking. Mr. John, do you drink alcohol?
Sometimes, occasionally, I'm a binge drinker on the weekend.
Okay. Is it at the limit, at the allowed limit? Or
Oh,
you have a binge alcohol sometimes?
in the weekend, I don't have any limit.
Okay. Mr. Jones, can I examine you?
Yes.
Okay. First of all, I want the temperature 38.5, blood pressure, vital signs was given. Okay, I want to examine the patient hands
Yes. What do you
for
want?
for any clubbing,
No.
any signs of any signs of infective endocarditis,
For example, what?
like Osler nodes, Janeway
Yes.
lesions.
Yes. Yes. I am having ocular nodes. Then no Geneva lesions. I have ocular nodes. I have
Okay, okay. Any clubbing?
no. What else?
I want to. Mhm. Splinter hemorrhage.
Yes.
Okay, I want to check the pulse.
It is regular, normal, equal, 70 per
Okay,
beat.
yeah. I want to check the eyes of the patients for any jaundice or any pallor.
No, I don't have.
Yeah. Mouth for any soreness.
No.
Okay, any red eye or painful eyes.
Yes, I told you I have red eye.
Yeah, I want to check by fundoscopy any rot spots.
Yes, it is there.
Okay, I want to check the auscultate for the heart. Any murmurs?
Yes, I have one murmur on the lower left sternal border.
2 minutes
Uh,
left.
it
Okay,
is
I want. Okay,
systolic murmur increasing with inspiration.
okay, I want to check the base of the lungs for
Nothing.
any crepitations. I want to check the lower limb for any edema. I want
No.
I want to palpate the abdomen for any splenomegaly.
Yes, I have splenomegaly.
Yeah. Mr. Jones, may I know what's your concern?
What do I have? Why am having fever?
Okay, Mr. Jones, we are thinking about a condition called infective endocarditis. This condition is soreness at the inner lining of your heart, and in your condition, it is the most likely result from this use of recreational drugs. Uh, Actually, this condition is associated also. This condition also affected your water work, so that you have this red urine. We need to admit you and to take some run some blood test and imaging, and we will involve the heart doctor. We will give you antibiotics through your through your blood vessels, and this condition may need prolonged treatment with antibiotics. Is that okay with you?
Yes. It is serious.
Actually, it is serious if not treated, and we need from you to stop the cocaine or recreational drugs that you are taking, because it is the main contributor of your condition.
Okay. And what about
So
my profession?
15 minutes gone.
Okay.
Wha-
Okay. Okay. Doctora, you did well. And now the examiner question start.
Yeah.
Okay.
Start.
Please
Yeah. Start.
present your case.
This Mr. John is 30 years old, present with subacute fever, present with subacute infective endocarditis in the form of fever for 2 weeks associated with tricuspid murmur. He using cocaine, and he has peripheral symptoms also of infective endocarditis in the form of osler knots, Janeway lesions, and rot spots. He has also hematuria.
Okay. And in the eye, I have rust spots. Then in the abdomen.
Splenomegaly.
So, okay. And how will you investigate the case?
We will request general investigation, CBC, inflammatory markers, renal function test, liver function test, and urine analysis, electrolytes, investigations to confirm my diagnosis. We will take blood cultures. We will do echocardiography and chest X-ray.
And how many blood cultures you will take?
2 sets of blood cultures.
With the gap of 1 hour, 2 hour, 12 hours?
2 hours.
1 hour from different sites. Okay, then how
1
you will
hour.
manage?
Okay.
How you will manage?
Yeah. This patient needs admission. We will educate and counsel the patient about his condition, smoking cessation, and we will give him advice regarding stopping the recreational drugs. We will start for him wide spectrum antibiotic according to the before the culture. You forget. We will start the vancomycin and
Okay.
vancomycin and rifampicin for
Okay.
this patient, and we will involve the cardiologist and also the infection control team.
Then what is
If
the
there is
diagnostic
any
criteria of the
complication,
infective endocarditis?
there is the Duke criteria.
Uh, diagnostic criteria?
Duke criteria.
Modified Duke criteria. What is this?
Actually, it depends on the blood culture findings and echo findings.
What will be the echo finding?
Vegetation.
Okay, then anything else on
No,
the echo? Abscess, dehiscence, valvular regurgitation. Then the minor criteria will be okay. Okay, Doctora, you did very well. You did very well. Mashallah, you did very well.
I was not organized.
Oh, a little bit. That's why we are here. I'm also like you. So, in minor criteria, there will be predisposing heart condition or injecting drug use, fever more than 38, then vascular phenomena. What are the parameters of vascular phenomena?
The vascular phenomena.
Yani which lesions will come in the vascular and which lesion will become in the immunological phenomena?
The vascular phenomena.
Splinter and genival lesions. And immunological?
There is a background
Ocular
sound.
and rough spots.
Okay.
Okay. Then what is the indication of surgery?
The indication of surgery. Aortic.
Same. The echocardic finding, like
Stop.
aortic root abscess,
Time
regurgitation of
stop.
a valve,
Five
and then the
minutes done.
dehiscence time, and dehiscence of the valve, then fungal infection, heart failure, and patient resistant to multi drugs. Okay. This is infective endocarditis. Are there any example of non-infective causes of endocarditis? These are the infective causes.
Like SLE,
SLE,
melanitic infective endocarditis.
Very good. So, what is the most common organism in the infective organism endocarditis?
Staph aureus.
Staph aureus.
Yeah.
What will be the treatment of Staph aureus?
What?
What will be the treatment of Staph aureus?
Vancomycin and rifampicin.
If
Or
it
maybe
is only
vancomycin if it is native barb, and if it is prosthetic barb, we will add rifampicin and gentamicin.
but only if only Staph aureus, we will give flucloxacin. But if it is MRSA, but if it is MRSA, then in that case we will give vancomycin.
Okay.
And most common organism after Staph aureus?
Streptococcus viridans.
Bovis.
Strep viridans.
Streptococcus bovis and vivid. And Streptococcus bovis is associated which other condition?
With CA colon.
Very good. CA colon. Very good. And what are the culture negative organism in which the culture will not become positive?
Echinella, Kiginella, and
Coxiella, brucellosis, Bartonella,
yeah,
and
Haemophilus. Okay.
Then in which case you will do the prophylaxis for the infective endocarditis? Prophylaxis for the infective endocarditis.
Any maneuver where there is gingival manipulation.
No, for the gingival, it has been absolute. Now, if you have prosthetic valve disease, number one. Number two, cardiac transplant within the 6 month. And then the congenital cyanotic heart disease in three conditions: prosthetic valve disease, cardiac transplant, and congenital cyanotic heart disease. Okay, you did very well. I just think that you will also take some neurological history. Likewise, there may be thromboembolism. There may be some vision problem and weakness with embolic phenomena. Apart from this, you covered almost everything. And ECG, what you will see? What you will check in the ECG?
In the ECG, any prolongation of the PR interval indicating aortic root abscess.
Very good. Okay. Now the house is open. If anybody wants to any comments, he is welcome. Any comment from others?
Dr. Azhar, you can mute the other participant.
Yeah.
Oh, okay. Mute.
It's very well done, Dr. Abtel, and it's nice case, Dr. Azhar. Thank you.
You see, I'm the new one holding this, so I'm searching the tools for the from where I will mute, because first time I'm holding such meeting. Before there was an option about mute. Please, it is requested from all doctors. Please mute your mic because it is disturbing us. So when you want to speak, you can unmute your mic. Thank you very much. Okay. Anyone have any comment? He can share it and discuss it. MashaAllah, Doctora did very well.
At this case, they can ask me about the differential diagnosis.
Yeah.
Yes, they can ask. So what could be the differential diagnosis?
It could be it is infective endocarditis. I don't know what is the differential diagnosis yani, at this case like this.
So anyone can comment what should we keep differentials in this case, because this is a clear-cut case of differentials.
I
Sorry,
can give
infective
endocarditis, could be SLE.
Yes, we can give the
I think first the
infective
hepatitis
causes.
and HIV because he has the high risk, and we should investigate for all bloodborne because he has tattooing and sometimes injure himself.
And
So it is
hepatitis
risk
B and
behavior.
hepatitis C.
Yes, you should include in investigation, and it will be the first differential for any patient with fever and high risk behavior.
Yes, hepatitis B, C, HIV, and SLE, non-infective causes. SLE
And weight loss with
meningitis.
fever, night sweet, we include also the TB and
Lymphoma.
the lymphomas and the leukemias. Yeah.
Yeah.
The lymphoma at the bottom, because history is not so long and there's no weight loss, no lumps and bumps. We will keep it at the end. Lymphoma, I think.
Okay.
Okay. Anyone have any question?
Yes, could you summarize for us the management plan, the treatment?
The treatment will be same as we will make the multidisciplinary teams, non-pharmacological and education and counseling about the disease, and then avoidance of alcohol, smoking, and then avoidance of the cocaine. And we can help him that while doing his job, because he is a tattoo maker and he's having pricks many times. So he should be very careful, or either he can change his profession. This is non-pharmacological, and pharmacological treatment will be if the patient is having native wall, then penicillin G and gentamicin. And if the patient is abuser, he is taking any drugs, then nafcillin plus gentamicin we can use. But the most examiner can ask you what is the most common organism in infective endocarditis. It is Staph aureus. In this case, we can give flucloxacillin. And but if in the culture it is MRSA, we can give vancomycin. Then he can ask what other most common organism will be Streptococcus bovis. It is associated with colonic cancer. And we will involve the multidisciplinary teams like cardiologist, infectious team, specialist nurse, and specialist doctor. We can involve. And most important thing is the prophylaxis, because nowadays the prophylaxis has been changed. Before we were giving for the dental procedure, now there is only 3 criteria. Any prosthetic valve disease patient is having, then for this we can give the prophylaxis. Any patient is having cardiac transplant within 6 months, then if we are going for any procedure, then we can give the prophylaxis. Then if the patient is having congenital cyanotic heart diseases, in these cases we can give the prophylaxis only for 3: prosthetic halva, cardiac transplantation within 6 months, and congenital cyanotic heart diseases. And in this case, there are two phenomena. One is the immunological phenomena. There will be oscillor and Roth. And second is vascular phenomena. In vascular phenomena, there will be splinter and genival lesions. And if the examiner asks you what will the culture negative organism, when you will send for the culture, no organism will come. In this case, you can say Coxiella, brucellosis, Bartonella, ASIC are patient partially treated with antibiotics. In these cases, the culture will be negative. And what will be the surgery? In case of surgery, same, it will be echo findings like this aortic root abscess, valve dehiscence, and regurgitation of the valve. Then severe valvular infection like fungal infection, multi-drug resistance, and severe heart failure. In these cases, we can go for the surgery.
Yes, thank you very much. This was very helpful.
Thank you very much. You are most welcome. Anyone have any comment? I think she missed this. Did she ask for HIV risk? I want to comment on this. Dr. Iltihab, you must ask about blood transfusion, surgery,
Yeah, I forget.
and
Yes.
sexual habit. So what you can make the mnemonic CBT. C means any contact with the sick person. B mean any blood transfusion. And with the blood transfusion, you can say any needles and sharing. T mean tattoos. CBT. Then S you can add any sexual history. Do you have a regular partner? Do you have a casual partner? If you have a casual partner, do you have safe sex or protected sex like this? CBT. Yes. C mean contact with sick person. B mean blood transfusion. Then you can add B needle and needle sharing, and T mean tattooing, and then S mean sexual history here. Very important. History of rheumatic fever. She asked me many times that you have any sore throat. Okay, she can ask fever in his childhood. She can ask, it may be the cause. Dr. Iltha, what will be the name of the criteria for rheumatic fever? Here, for the diagnostic criteria for the infective endocarditis is modified Duke criteria. And for rheumatic fever, what will be the criteria? What's the name of that?
Jones criteria.
Jones criteria. Very good. Jones criteria. Okay, if anyone doesn't have questions, then Dr. you can post the scenario for me.
Okay. Hello, who is posting the scenario?
You can, if no problem, you can put in the group.
Okay.
Because I also do not know how to bring here in the chat box.
Okay, so like I'll say in like so the patient present with polyuria and polydepsia. Hello?
Yes.
Is that okay? The vitals are okay.
Vitals okay. Then age,
Nothing.
patient age.
Age like 52 years old.
Mhm. And then name of the patient.
Name you can choose.
Male or female?
Male.
We can make any name, huh? John,
Yeah.
okay, we make John,
Yeah,
huh?
yeah. Male, 52-year old, had polyuria and polydepsia.
Okay. Give
And
me 2
vitals
minutes.
are normal. Mhm. 2 minutes.
Okay, can we start?
Yeah. I will
Hello,
see.
my name is Dr. Azhar.
1 second. I will start the timer. Sorry.
Okay, no problem. You start.
Okay, start. Thank you.
Hello, my name is Dr. Azhar.
Yeah.
Are you Mr. John, 52 years old?
Yes, correct.
Okay, Mr. John, today we are here to discuss about your health problem.
Mm-hmm.
And I will also examine you. Is that okay with you?
Yeah, sure. No problem.
Okay, Mr. John, can you explain me what brought you here today?
Because I'm having this like problem in my urine. I'm passing too frequently, and I have to visit toilet so often. It's making my life like hell. And also like it's not as usual. Like before, I was very fine and fit, and sometimes I feel like so thirsty as well. So it's not going well with my lifestyle. So that's why I'm worried, and I wanted to visit you.
Okay, I'm sorry to hear about this. I will try to solve the problem. Can
Okay.
you tell me for how long you are having this problem?
Before I had like 1 week, then it was stopped. Then now it's like been 2 weeks. It's getting worse and worse. I thought like I had lots of water that time 1 week before, like before these 2 weeks, but it was okay after I didn't drink that much of water. But now it's like getting worse. I don't know what is happening with me. Like it's unbearable. Like I have to stand up in nights, day, and in work I have to go frequently toilet, so it's disturbing my work life as well.
Okay, it
Since
is a
3 weeks.
volume or 3 weeks. Okay, it is a volume or the amount which has increased.
Its frequency
Or
also
frequency.
increase and volume also increase, like
The
not.
frequency also increased.
Yeah.
Okay, okay. And before 3 weeks, you were totally all right.
Yes, doctor.
And how you are compensating this? You
I
are
don't
taking
know.
more.
I'm not taking, like, I just like thought some people said like I drink too much of water, but then I stopped drinking water that much, like water. Then also it was happening. Then I thought it's not because of water drinking. So now I'm worried. What is going with me?
Have you noticed that anything have improved your condition?
No, I haven't.
And
It's getting worse.
any condition which makes it worse?
Like
Hmm?
like
Like you have taken any medication?
no, nothing like that. Nothing like that.
Now how it started? Gradually or suddenly?
Before 1 2 days it was like, I didn't notice that much because I was at home. So after that it is increasing day by day.
This is first time you are having, or before
Yeah,
this
it's
3 weeks?
first time. It's
First time.
first time. Yeah.
Okay, Mr. John. I just want to know, do you have any past medical history or long-term condition which I should be aware of?
Yeah, doctor. I had melanoma surgery a few years back, like 1 year. And then after that, it was totally fine. They follow up me. I used to go in follow up, but I don't know.
And you
And they
have a
give.
regular follow for this melanoma surgery?
Yeah, I used to, but right now it's they said you are okay, so I don't go.
Okay, you are not going. For how long you are not going for the follow?
After 6 months, I didn't go.
For the 6 months you did not go.
Yeah.
Okay. Are you using any medication? Beside this melanoma surgery, do you have any other medical problem?
No, nothing.
Can I see your medication list?
Yeah, it's nothing. I don't have any medications right now.
Any family history?
No.
No. Okay. Any change in the color of the urine of
No,
the
it's
water bottle?
like no, it's like whitish, like you have how color watery, like same color, no change in color. There is no blood, nothing, but just I'm getting like too much of urine.
And any frothiness?
No,
Any burning?
no.
Do you wake up at night and you have to go to washroom again and again?
Yeah, that's
And when you are going in the washroom, the flow is normal, or it takes some time to start, and then
no. Its flow is
at the
normal.
end there's a
Flow.
doubling.
No,
Hmm?
flow is normal. No problem with like starting or something like that. Just I have to go frequent toilets.
And at the end there is any dribbling.
No, nothing like that.
Okay. And what about your diet?
Diet recently it's like decreased.
Your diet has decreased.
Mm-hmm.
And do you have any fever?
No,
Okay. Do you have any weight changes?
I haven't noticed.
Any night sweating?
No,
Any lumps and bumps?
no,
Any weather preference?
no,
Do you feel dizzy when you stand up suddenly from your sitting position?
no.
Any past history of surgery?
Just melanoma I had.
Uh, any trauma to your head?
No,
Any chemotherapy?
no.
Any
Right now,
radiotherapy?
no. No.
Huh?
Right now, not. Before 6 months, they give me just the surgery and chemotherapy. That's it. After that, it's stopped.
And chemotherapy, which area of the body they gave you?
Radiotherapy in the wound, nearby wound.
On the skin, huh?
Yeah.
Okay. Do you have any back pain?
No.
Any joint pain?
No.
Any cough?
No. I have headaches.
Okay, you have a headache. For how long you are having headache?
Like since 2 weeks.
Like 6 weeks.
2 weeks.
And what is the character of this headache?
It's early morning headaches, and it's worsening every day. Like first day I have little bit low, and now it's very much like too much headache. Like while I'm walking up, it's getting too much painful in my head.
Okay, and if this headache, at what time it is more headache?
In the morning.
Uh, does this headache increase with coughing, sneezing?
Yes. Yes, doctor, you are right.
It's okay. With bending. Do you have any visual problem?
Vision, no.
This headache for how long you told me?
Like since 2 weeks, it's very worse. On and off since 3 months.
3 months you have this headache.
Yeah, but of 2 weeks, very worse.
Any problem with your speech?
No speech problem, but I having like throwing up like sensation, but not throwing, but throwing up like sensation.
Okay. Any weakness in your limbs? Numbness
Nothing,
and
nothing.
any sickness?
No,
Any change in bowel habits?
no,
Any abdominal pain, tummy pain?
no.
Okay. Mr. John, I want to ask you one sensitive question.
Yeah.
Do you have a long-term relationship?
No, I am single.
Single. Okay. Do you smoke?
No, because when I had melanoma, I stopped it.
And do you drink
No,
alcohol?
no.
What is your job?
I am primary teacher.
And how is it is affecting your job?
Oh, it's terrible. I cannot like teach my student or make a plan because I have to always go to the toilet.
Okay, I will try to. I'm sorry to hear this, and I will try to solve the problem.
Mm-hmm.
Do you did you travel anywhere in the recent
No,
past?
no,
Do you have casual partner?
no,
Okay. Do you have rash?
no,
Any allergy to any medicine?
no.
Okay, can I examine you?
Yes,
Okay, I want to examine. I will start from your hands. Any clubbing?
no clubbings. Journal examination is fine. Nothing.
Nothing. Okay, I want to check the eye pallor jaundice.
Nothing. No paler, nothing. Journal examination, lymph node, IgB, pulse, everything is okay.
No, no. Then I want to check the visual acuity,
Normal,
visual fields,
normal,
H-shaped movement,
normal.
and I also want to do the fundoscopy.
Okay, there is nothing.
Nothing. Then any lymphadenopathy,
No,
any in the chest. I want to examine any basal creps
no,
in the heart. Any murmur
no murmur.
in the tummy. Any hepatosplenomegaly or
No, nothing.
nothing. Any about any
Mm,
kidney problem or
no,
any leg swelling.
no.
Okay. So, Mr. John, as you told me that you have polyuria and you are passing more urine from last 3 weeks
Yeah.
and polydepsia also. And
Yes.
besides, you have a past history of surgery of melanoma 1 year before, and you are having headache
Mm-hmm.
from last 3 months, and
Yes.
from the last 2 weeks, it has become
Yeah.
more. Is there
Yeah.
anything
Yeah.
you want to add it?
I don't remember because it's getting worse. I feel like my life is terrible.
Okay, and your weight is stable or weight? What about the weight?
Right now it is stable. Like my appetite is little decreased, but weight is okay. I'm fine.
Okay, Mr. John. What is your concern?
Because I'm worried that what's happening to me. I don't know. I was all right, right? Now I'm getting worried. What is happening to me?
Okay, what I gather from your history and examination, I'm just thinking that I have some options. Like due to this, I think that you have some uh, mass in your brain, and
Mm-hmm.
due to this, you have a mass in your brain,
You
and
mean
this
mass? What
uh,
mass?
mass, you can say there is some lesion in your brain, and it is
Okay.
compressing on our master gland, and
Mm-hmm.
due to this some hormones they are not uh, they are properly secreted, and due to this problem your
Mm-hmm.
and these hormones have to act on your water work passage,
Mm-hmm.
and I
Okay.
think because of deficiency of this hormone, which we call in our language is ADH hormone, it
Mm-hmm.
is not working on that. That's why you are having this problem,
Mm-hmm.
and because of this reason you are passing more urine.
Mm-hmm.
So what I will do, I will run some test and I will
Mm-hmm.
do some scans.
Mm-hmm.
When I'm having the final result, then I will be discussing with you. Is that okay with you?
Doctor, you made me worried. I will be okay or not?
Your question is very well valid. I cannot say at this time.
Mm-hmm.
I have to take some scans of your brain,
Mm-hmm.
and then some blood test, and then after then I will be able to uh, reply your concern.
Okay,
That
doctor.
okay with you?
Yeah, but okay, no problem. Thank you.
Okay, do you have any other concern?
Yeah, so can I go home?
Uh, at this time, I want to admit you because
Mm-hmm.
I want to see if you are dehydrated because you are passing more urine. I want to hydrate you, and I want to take samples,
Mm-hmm.
blood samples, and then after then with my consultant, I will involve the multidisciplinary teams like nerve doctor, and then the kidney doctor and specialist nerve and specialist doctor.
Time up.
Okay, thank you.
Okay, so I will again clear and now examiner question. Okay, I'll set the timer. Start. So can you tell me the positive finding on examination? Did you find anything?
I did not find any positive finding on the examination, except on the history. I found that this patient is having passing polyuria, and patient is having headache that is more in the morning. And
Mm-hmm.
I'm thinking that the patient is having, I'm suspecting that the patient is having some brain tumor,
Okay.
maybe, but I'm
Okay.
not confirmed. I'm not confirmed, and this is pressing the pituitary gland, and that's why the patient is having this problem disturbing the ADH hormone.
Mm-hmm. Okay. So can you give me the differentials of it? Like polyuria and polydipsia.
There
Differential.
may polyuria, polydipsia, the patient is diabetes mellitus,
Mm-hmm.
but did not give me any history of any numbness, tingling sensations,
Mm-hmm.
and patient denied of any past history of diabetes mellitus,
Mm-hmm.
and and then I do not also history. There may be change in the face, facial appearance, acromegaly. There may be polyuria. Their patient can
Mm-hmm.
have diabetes, and there may be Cushing syndrome.
Mm-hmm. Mm-hmm.
I can also put in Cushing syndrome. There may be also patient is having, but I could not find anything uh,
Mm-hmm.
in the favor of these.
Okay. So which type of cranial diabetic insipidus is it?
It is
Diabetic. Yeah.
uh, it is cranial diabetes.
Okay. So can you name some like disease or any medication that can lead to diabetes insipidus?
Yes, yes. If the patient is having any tumor in the brain, if
Mm-hmm.
the patient
I
is
mean
having,
not as a whole, okay, not cranial only, okay. Diabetes insipidus. I want to know the drug medicine names.
there's some drug like lithium, it can cause
Mm-hmm.
diabetes insipidus,
Mm-hmm.
and
Okay.
dimethylcycline.
Mm-hmm.
electrolyte imbalance,
Okay. So,
calcium
like,
and
how will you
potassium.
investigate in this patient?
For the investigation, in the routine investigation, CBC,
Mm-hmm.
ESRC, ESRC reactive proteins,
Mm-hmm.
LFT is baseline, and renal function test with the urea electrolytes and urine examination, and most important is urine osmolality and plasma osmolality. In this
Okay.
case, the plasma osmolality will be raised, and urine osmolality it will be less than 200. And
Okay.
then I will also want to measure the ADH hormone,
Mm-hmm.
and I will also go the water deprivation test,
Okay.
and at the end of the water deprivation test, I will do the I will give the vasopressin.
Mm-hmm.
If the osmolality improves, it means it is cranial. If the osmolality will
Okay.
not change, it means it is nephrogenic.
Okay.
I will do also the MRI of the brain also.
Okay. And anything else?
In the investigation,
Yes.
serum electrolytes and glucose, I will also go for the diabetes,
Okay.
fasting blood sugar, and HbA1c.
Okay. So, how will you manage this patient if he had cranial diabetes?
If the patient is having cranial diabetes, I will give ADH hormone. I will give ADH
Mm-hmm.
hormone in the form of nasal.
Mm-hmm.
I can give oral, IV, intranasal, and subcutaneous.
Mm-hmm. Okay. Thank you. Okay. Thank you. Your time up. So, what do you think?
I do not know. You will tell me.
No, your history taking is good, but however, I just want to like point out few things, okay? If you don't
Yes.
mind.
No, 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 no. We are here for learning.
Yeah, because I had to tell you headaches because you didn't ask me. Okay.
I was
You are
going to ask. I
you are
was going
asking
to ask.
everything. You asked me lymph weakness, nausea, everything. But headache is the first most you have to ask in CNS,
Yes,
okay?
yes,
And you didn't ask me my mood. I told I'm not feeling like, working, but my mood is fine.
yes, yes. You are right. But it should be because if your
Yeah,
mood is disturbed, maybe you are taking
yeah,
some drug,
yeah,
lithium.
yeah. Because I might be very like depressive and I left that drug, maybe, yeah. But in this case, my mood is fine. So you have to rule that out, okay? You didn't this thing, and you didn't ask me about driving, okay?
Yes, I forget. I forget driving.
And you didn't ask me about I think I don't know. You did ask me recreational drug or not? I don't know.
Huh?
I didn't
What?
recreational drug like
No,
cocaine
no,
or
no,
anything. No.
no, no. Always I'm no forgetting. Recreation,
Yeah,
I did not.
driving and this thing is important in this case because they are UK people, sir. That's
Yes,
why
yes.
nothing important. So you didn't ask me like gastrointestinal tract system, like little bit details, like bowel constipations. You didn't ask me, okay? Bowel change. You asked me abdomen pain. Then you asked me urine, everything. You asked me chest pain, palpitation, fever, chills, nice what you asked me, but you didn't ask me about gastrointestinal tracts, like bowel problems, okay?
Okay.
Because he has a history of melanoma, so we have to rule out its metastasis or not, okay?
You are, you are right.
Okay, sorry, eh? If I'm rude, then I'm sorry. So, and
No,
then
no,
in
no, no. You are right. We are here to pick our mistakes so that we cannot repeat these mistakes in the exam.
yeah, I also do lots of mistakes, so it's okay. Then you differentiate all the like diabetes insipidus, cranial or nephrogenic. You did. You asked me about osmotic diuresis. That's also good. Primary polydepsia, psychogenic. You asked me with the water drinking, so that's also good. I'm telling good part also. Okay, that
Yes.
was important. So you didn't ask me like, do you drink alcohol, tea and coffee?
Okay, tea and coffee. I'm writing.
Because if you have more tea and caffeine related drinks, then you will have more urine production. or,
Yes,
or
yes.
you drink at the night, you can ask that. Like if I drink lots of water at night, then it will be obviously I will go many times at the toilet. But it is not in this case. But however, it is very important. You ask me all the things like weight loss, lethargy, recurrent urine infection, thrust, everything. Okay, so no need to ask. But I found like pituitary system you missed. I think for like investigation, you had to tell the anterior pituitary function test as well.
Yes, 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 yes. I only
TFTs, ACTS,
MRI.
IGF 1 LH, FSS, short synaptic test. I
Yes.
would like to know. I don't know. I don't know about others.
No, 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 you are right. It should be. It should be. I only told you about this MRI of the brain.
Yeah,
Pituitary function also
yeah.
necessary.
So otherwise, it was good.
Okay, thank you. But
Thank you so
okay,
much.
welcome you. Because I wrote all these things which you told me. Inshallah, I will try to improve.
No, no,
So
you are very good. Just I want you to be excellent. Very good and excellent.
thank you,
So
thank you.
that's
You are
why.
also very good. You also did the case very nice.
Because like I give the main case which I read and then I gave you. But I will
No,
tell you the thing. A nephrogenic NSIDs, indomethacin, you also have to remember some time to treatment for nephrogenic or thiazide diuretics
yes, yes.
for
Thiazide,
nephrogenic.
aspirin, and
Yeah,
brufen. Thiazide, aspirin, brufen. This will be for the nephrogenic.
yeah.
And the
And
differential.
craniogenic, you will have desmopressin for treatment. Okay.
Yes.
And
And
the
the
causes like DI, you know that nephrogenic is lithium, hypercalcemia. I wanted you to tell me hypercalcemia also.
yes, yes. That's why you told me that I must have the constipation.
Yes. And
The
moods.
differential which now it came to my mind. It may be histiocytosis,
Yeah.
hypercalcemia, hypokalemia,
Yeah. That's
medullary
true.
system disease, type
Yeah.
1
This was
diabetes.
tough question, tough differential because I know you are very intelligent. That's why I felt so. That's why I gave you. Thank you so much.
Thank you. Now, anyone has any comment? Today our boss is not here. Uh, I'm first time I'm leading this role. So inshallah, so this week it is my duty. We will do it. So if
Yeah.
anyone has any comment or any suggestion, we are here to listen you.
Yeah, you did good.
Thank you very much.
Differential, it will be like related with you have to be like
Differential,
hypercalcemia,
differential it will be,
hyperglycemia, and diabetes insipidus. Three things is more than enough. In this case, the patient had melanoma. It is the case of metastasis.
metastasis. Very good, very good.
That's why he didn't have any problems. That's why it's better us to explore the history of presenting illness and then family history, his past medical history in details, like social history, drug history, everything. Then we can review a systemic wise by two questions.
Yes, I asked all the question about trauma, head injury,
Yeah, you asked me everything, but there was nothing.
nothing. Chemotherapy, radiotherapy, and
Nothing,
you
nothing.
give me the hint of headache.
Yeah,
Then I said it may be there may be tumor,
yeah,
there lesion. You are right. It may be metastatic from the melanoma
yeah. If
because it got
somebody
recorded
asks,
from the
yeah,
last 6 months.
yeah, you are right. You were going in like the case, but I had to prompt you. Like in exam, nobody will prompt.
If the surrogate is good, he will prompt me. No,
Yeah, but
if you will
some
not,
center they are very
then I'm
bad.
thankful very much. I'm thankful to you. But if you will not, at that time, if you will not tell me, definitely I will go for the headache.
But your time was
But
out
but
for
yes,
examination.
yes, yes. But when you told me headache, you gave me. Then at that time, I clicked the diagnosis.
Yeah, yeah, that's true. You are really good, but the history taking was a little bit lengthy. That's
Yes,
it.
yes. Always, sometimes Dr. Basam told me you are taking history up to 12 minutes. So I'm
Yeah,
trying
yeah,
to reduce
true.
it up to 8 minutes. It should be up to 8 minutes.
Yes. Because you ask everything which can be ruled out in 2-3 questions.
Okay.
But you are good. Like if they give 20 minutes, it would be very like nice, but they give us just 15 minutes. So in 1 minute, for me, I will be like very anxious and freezed, then it is gone. So it will be only 14 minutes.
Yes, yes.
So okay, no problem. And in here you have to check the CNS properly. Okay, it doesn't matter you check all the system or not.
Yes, yes.
So thank you.
Thank you. Welcome. Welcome, sir. So if no more question, can we end the meeting?
Yes, thank you so much.
Okay, I will stop the recording. First, I will stop the recording. Tomorrow, if anybody, tomorrow, I think I and Dr. Najla, we will be presenting the case. This will be tomorrow will be the communication day. If there is any change, then inshallah, I will inform you. Tomorrow, there will be communication day. Okay, thank you very much.